Okay, so the first question for the superintendent, this person says that they appreciate that you're making plans for elementary schools to reopen. However, the remote program is suffering significantly. What are the plans to address parent and student concerns with remote?
Well, it's funny. Yeah, I just got off the phone with a couple of high school counselors. There's a lot of issues in the remote program that are some general and some distinct at each level. We're trying to kind of work backwards based on what's most impactful to students in the long term. I think a lot of the fears and questions that I'm hearing initially are from high school families who are worried that with grading periods coming up, if they're going to be kind of locked into quarter grades or semester grades, that would that be injurious to their future hopes to applying to public and private schools. So we had a pretty good working group meeting yesterday with the folks in the remote program, the coaches that are supporting it, the principals, et cetera. And I think we'll have a communication tonight coming out with a progress report on some of kind of the key issues. We're also going to schedule I shouldn't say in person, a virtual progress report for our high school families in the remote program by next Tuesday. So I think some of the solutions to pacing, grading, some of the consistent themes that we've heard about, those will at least have a clear idea on where we are in terms of solutions by next Tuesday. I think we're shooting for next Tuesday at 5. Hasn't come out officially yet, but that will happen. Subsequently, I think we'll be getting together with our elementary and middle families in the following week. The issues at the middle and elementary schools still do in many ways seem to be centered around pacing. As it's been well publicized, we moved off of a particular curriculum that probably, certainly had content flaws, but was probably a little more user-friendly in terms of how it kind of walked kids through a self-paced experience. I think the curriculum we have now needs more support. So whether or not we need to bring in tutors, we need to bring in additional staffing to kind of support kids in their practice, right? We're asking a lot of parents in general. The remote program, that seems to be particularly acute. So there will not be super simple solutions, but I think there are things that we can do structurally and in terms of offering families flexibility around the curriculum, however flawed, that I think will really help. So let's take away the anxiety about you have to finish this course by X date. Can we work with admissions officers for our high school kids to make sure that we give those folks plenty of information about the unique challenges of this year, et cetera. I think, I'd probably be doing some of the significant issues a disservice by trying to talk about them off the cuff and in depth. But again, we are aware of those, and there'll be a communication going out to our remote families tonight with a progress report on some of the major issues and opportunities for us to get together beginning next Tuesday.
Thank you.
What else, Sarah? Yep, we have a bunch. So the next question, going into cold and flu season, is there thought of pushing off until past December 2020?
It's come up a lot. It's come up a lot for sure. I mean, and that's what we're in that's the constant tension that we're sitting in, right? The short-term challenge of the public health components of this mess, and the long-term implications of keeping kids out and keeping kids, away from their peers in kind of a managed social setting for a while. I think, Sarah, that's part of what we're trying to do on the 27th is, let's say, if there is a date this side of the calendar year that we could come back in early December, let's set that date in October 27th. Let's watch the metrics for a few weeks. Let's watch how our plans finalize. And if we had to push it back to January, let's make that decision in November. That still gives families a month, from what an initial proposed, say, December return might look like. So yeah, I can't imagine we'll come to the 27th with just one date. I think there's going to be a plan A, plan B, plan C scenario for exactly the reason that's embedded in that question.
And, I'll just throw in my little commercial that I never stop giving commercials is, and if Dr. Lisa, I think our pediatrician mom had to drop off, but I bet she would second this. It is so important to get your flu shots. Get your flu shots now. Get them yesterday. Anyone, the CDC and the Alameda County Public Health Officer recommends that anyone 6 months of age and above gets a flu shot, because it's especially important now if you were to get COVID. We hope you don't, but if you were, your symptoms would be more serious if you also had the flu, and we don't need an epidemic on top of a pandemic. And our healthcare system, as Tracy would confirm, is already stretched to the max. So, but the good news is, if you practice all those things you're supposed to do to protect yourself from COVID, you are also protecting yourself from the flu. So another reason to do it. Okay, back to
Amen.
Pasquale and Sarah. Sarah, what were you going to say, Pasquale?
No, I was saying amen on the flu thing. We need the community to double down on things like that and the basic strategies of hand washing, masking. You know, the community's work in keeping these case rates and positivity rates down are the things that are going to allow us to come back quicker and stay back when we're back.
That's right.
The next question is an easy one. They asked, is the slide deck available publicly? So
Yes.
if you can send it to me, I can post it, or great. And then
Ms. Davis, that is a true statement that I've just made. It is publicly available.
Yeah.
It is. And also the video is available. So Sarah, I'm going to send that to you right now.
Fantastic. Let's see, the next question. How is the district identifying students who are displaying mental health issues, and what are you doing about it? This person's especially concerned with lower socioeconomic and disadvantaged students. How is this being tracked? Tiered assistance, perhaps?
Yeah, absolutely. I mean, our coordination of services teams at the elementary level and actually throughout the K-12 continuum have stayed active. I think some of those groups have paid even more attention to families. The filter has been the filter has been pretty ready-made just through attendance, right? Kids that we don't see online, kids that we don't see in absence. So our existing systems didn't go away. Alameda Family Services has continued their work throughout this and are still available for appointments for all the types of services that we depend on with them. You know, generally, I find the most effective referrals come from caring classroom teachers who are involved. They're the folks that refer cost teachers, you know, students to the cost team who can do a little more in-depth analysis about what's going on for the family, what's going on for the students, et cetera. So it's really not been a case of reinventing the wheel, just kind of making sure the wheel is spinning a little faster during this time.
And
Right.
Pasquale, if there was a parent who had a concern with their child at whatever age level, because I'm hearing about, you know, stress levels are high across the board, what would be the parents' what choices are available to them?
I mean, I would say that, you know, if parents feel comfortable in their relationship with their primary teacher, that's a great place to start. If not, the principal is a great place to start. All of our elementary schools have what we call intervention leads. So there are people who head up the groups on campus that regularly assess students' needs, both in the academic and social and emotional realm. So that would be the first place to start in terms of what I would recommend. Additionally, another thing that our student services department has started doing is these kind of knock and talk things. They're not kind of intrusive, but we're actually sending student services staff out into the field to kind of knock on doors and go try to say hello to people that we haven't seen in a while. We're trying to be really respectful and not intrusive in that process, but we are getting out into the community, trying to contact those families who may not be in as regular contact with us as we want.
Nice, thank you. Sarah, I know there's more, huh?
Yep, just a few. I have two questions asking how AUSD is celebrating Pride Month. And I know that this month is LGBTQ History Month.
Right.
Yeah, I think we're probably a few days away from announcing that. And Susan, I think some things that you may have up in the queue. Is there anything that we're ready to reveal now, or is that?
There's nothing that we're ready to reveal now, no.
Okay, yeah. Coming up, I mean, part of that is, you know, in part where people are in terms of bandwidth, but there are some things in the works. So if you can give me a day or two, we could get something out in our next communication or newsletter. Certainly something we want to support. It's very important to us here that all our families and students at least just know or hear our acknowledgement that they are in our hearts and part of our community, and that even for those kids, there are, you know, some difficult challenges when you talk about teenagers and adolescents, kids coming out and being kind of isolated during these times, and the challenges that those things present to students and families. So on the kind of more formal district-wide stuff, I'll have to get back to you on that. I know there's plenty of
Yeah,
stuff
no, a really important topic with no breaking news here. Okay,
at individual schools for sure.
we won't scoop that story, but we'll look
Yeah.
forward to it. So stay tuned to the AUSD website. Is that?
Yeah, and to your individual school principals as well, because there's some very nice stuff that I know our principals do regularly that are in
School
the
by school.
Yeah.
Great. Okay.
Next question is asking just who sets the protocols or guidance if there is an illness in the classroom for the class or the school to move back to remote teaching?
Yeah, it's a great question. It is. There is in fact a standard that public health has put out. If 5% of the students in a cohort become ill, that cohort would be shut down for a period of time. There are other percentages and a rubric that talk about if a number of classrooms had to go into quarantine or be in remote learning for a period of time. There's a threshold wherein the whole school would shut down. And I think, I don't have it right in front of me, but I think if 1 in 4 schools in the district were to have to shut down, that would be the threshold at which we would put the whole district back into remote learning. So it would be an incremental progression, and a case here, a case there, or even one school shut down would not necessarily mean the entire district would shut down. But they're pretty clear rubrics from county public health guiding that.
When will the district allow youth groups like Alameda Youth Basketball to use the school facilities?
Well, that's a tough one. And I know you guys were talking earlier about reopening playgrounds. But for us, almost everything and anything we are doing right now is geared toward keeping our sites as contained and stable and manageable as possible until we can get core instruction up and running. So I don't have an exact time frame, but I think if you looked at our return plan as kind of a 4-phase return, it'd kind of be towards phase 3 or 4 where I could see that happening. We're going to be extremely limited in who can access campuses, even during the day in an initial return with kids and teachers on campus. We don't envision offices to be open. All adult meetings will continue to be conducted this way. So the goal is really going to kind of keep who's on and off every one of our campuses extremely tight in the first phase of a return.
And I just want to throw in a quick thank you, though, to AUSD, because I know that you have made several of your properties available to be accessible voting locations for our for this upcoming election. And you've got 4 days to vote in person. Actually, you can vote now by just dropping off your ballot in a drop box, one of our 3 drop boxes, official, sanctioned, placed there by the county drop boxes at the site of City Hall, College of Alameda, and out in front of the Bay Farm Branch Library, Laydecker Park building. But also from October 31st through Election Day, we have Lincoln School, Alameda High, Island High. Those are the 3 district locations I want to say. Yeah.
Mm-hmm.
Thank you. We appreciate that. I know Sarah's got more questions, and it's 101, but if we
yes.
speed talking and just give you a couple more minutes.
So I have 3 questions for the superintendent, and then I have 2 questions for you, Mayor. So maybe he can pop off and you can.
Oh, you can give mine to Pascal. He's doing really
well. There you go.
Let's switch and see what happens.
You want to be there for a day, and I'll try. Yeah.
No, it hasn't gotten that bad.
It's Freaky Friday, right?
That's my job. Oh, it's Freaky Friday.
I'm kidding.
Okay.
Freaky Friday, that's a great reference.
Yeah. Will there be a discussion about on-site aftercare programs returning when school reopens?
Yeah, I think that is a little further back in that kind of phased return. And I know that even the initial schedules that we're contemplating and what I'm seeing put into play in other places haven't quite solved that problem. And so I'm already hearing from colleagues throughout the county in Southern California about how the in-person return has still not solved the child care issue, nor has it brought a lot of relief to particular groups of families in the district. We're operating on the premise that if we can get up and running and get folks back into class, then we can start to look at the fact that there is county guidance that will allow us to have kids accessing multiple cohorts at a day. So once we get up and running and our cohorts are somewhat stable, then we can start saying, okay, in this 3rd grade group at school X, we also have an aftercare program that can come in, and those kids, so long as they're only accessing 2 cohorts in a kind of extended bubble, we can move in that direction. I think, again, I know there are people that want and have an immediate need, But until we get in our buildings, see what operations look like, see what additional spaces we're going to need. We're going to need more spaces to keep sick kids comfortable until they can get picked up, all kinds of stuff like that. We're not going to really know what our facilities look like in terms of what's available until we get up and running and operable for a couple of weeks.
Speaking of spaces, the next question was, how has the school district evaluated teaching outdoors versus going back into the classrooms?
Yeah, it's a really great question. We're certainly going to encourage in our reopening plan that, even if kids come back for, 140, 180 minute sessions initially, that wherever possible that we utilize outdoor space. Some of the challenge is in our district and in every district is that not all schools have an equal or equitable amount of space that is shaded and usable all day, right? Depending on weather, depending on X, Y, and Z variables. We're trying to guarantee that at least every school has one, say, 24 by 48 space that is either in shade most of the day and can be utilized, or that we can temporarily supplement a space with some kind of approved or safe canopy. That's not a solution when we get everybody back, but if the initial stages of our return mean, say, our transitional kinder kids through second grade, smaller amount of kids, smaller amount of classes, and that rotation through the outdoor space means more people being able to utilize an outdoor classroom. It is something I definitely think we should think about moving forward in future bonds. Now that we have this with us, what do long-term modifications to our facilities look like? And maybe let's get into some serious investments in outdoor classrooms and learning spaces.
Great. And then just to say that you've gotten a few just big thanks, thank you, lots of thumbs up on Facebook. So I just wanted to note that. And then the last question is, what level of parent input is the district going to gather before opening back up?
Yeah, great question. So as I said, our goal is to make the reopening plan available next week. And the same thing that we're going to look at internally is the same thing that we're going to provide to the parents. Like I said, we want to give folks about a week to digest that before we go to our board on the 27th. And then between the 27th and the 11th, we plan on being out in these spaces quite a bit with our parent groups. I like to kind of try to organize those in ways where we can actually be in dialogue with parents. So it may be school by school, it may be elementary A, elementary B, but we'll definitely be doing a lot of community outreach in the next couple of weeks, and a big parent survey with some pretty explicit and direct questions about comfort level with return, lingering considerations and concerns, all of that stuff. I think next week, Susan, do I have that right?
Yep, it'll be next week.
Next week, okay. So that's the current broad plan on parent engagement.
Wonderful. So Mayor, the last two questions are for you.
And I just want to, Pasquale and Susan, if you have to drop off, we understand, but I just want to give a big thank you, I know on behalf of all the audience. Fabulous information, so important. I told the city manager this after we met with you a couple weeks back, that I think it's tougher to run a school district than to run a city, and neither are easy jobs. But kudos to you for how well you were just rising to every challenge and every there, yes, I'm seeing lots of clapping hands out there, jazz hands. But really, we're lucky to have you, and good leadership is so important at a time like this. So thank you for being there at the helm. And Susan, I know from my personal experience that I could not do nearly what I do without Sarah behind me. So thank you for all your good work and helping keep our families informed, because I do find that people, they just need to be informed. We can't always give you good news and sunny, bright news, but we'll tell you the truth. We'll tell you what you need to do. Please believe us. And you do. I mean, that's why, again, why we've made such progress. But it's, there's still challenges ahead, but I'm confident that we can meet them working together. So lovely to have you as community partners.
Right. Thanks for the invite.
Oh, my pleasure. Thanks for responding. Take care. Stay safe. And what are my questions, Sarah?
So yes, I always appreciate when people respond to our invitations. Okay, so then the next question, is there a chance that the core COVID testing site will return to Alameda on a more steady basis? It was so well organized, they said.
Wasn't it great? The core, for those of you who don't know, and this was and here is a shout out to City of Alameda staff, because literally after one of these town halls, few weeks ago, maybe it's been 3 weeks now, time is a blur for me these days, but I got a call from a contact at Alameda County Public Health saying, Mayor, would Alameda like to host a pop-up 4-day COVID test site? And I said, of course they would. When? And she said, starting Wednesday. And I said, as in this Wednesday, and it's Friday afternoon. She said, huh? And I said, sure, let me just shoot out a couple emails. And so I quickly, or maybe I called the city manager and said, hey, I think I sent an email so I could send the details. But over the weekend, our city manager, Eric Levitt, assistant city manager, Jerry Bowden, they worked together and reached out. We needed to find a site. And then which Penumbra out at Harbor Bay Business Park very graciously said, you can use our 2,500 square foot parking lot for drive-through, because it's all drive-through. So CORE stands for Communities Organized to Respond to Emergencies, and it's part of an organization that the actor Sean Penn started. He's really proactive. I mean, going back to Hurricane Katrina days, and he just, he puts his money where his mouth is. But so what I knew from County Public Health is that they've been using them out in East Oakland, phenomenal results. But then there was, for some reason, the particular host site had a few days they couldn't host them. So they knew Alameda has been waiting. So we said, come on down. And so in those 4 days, Wednesday through Saturday of that week, we tested hundreds of, not we, I didn't do it, but they brought their personnel and everything, tested hundreds of people a day, and it was a great success from everything I heard. We have, and the county was really impressed, as well they should have been, with staff's great turnaround. So when another opportunity arrives, you bet we'll do it again. But even sooner than that, because we just have to be ready when they say, we're a victim of our own success in some ways, because Alameda has been able to keep our positive COVID test rates per capita down to, we're like the 4th lowest rate in our county. We kind of get pulled out of the queue sometimes when we're moving up there to get the county to give us a test site. But we have been working with another outfit. In fact, we interviewed one of their scientists a couple weeks back, and it's called NextGen. And I will say that we have a very promising prospect to set up a test site for NextGen that maybe, I'm not even sure of the last conversation, whether it was going to be a hybrid, Sarah, combination, walk-through, drive-through, but there are plans in the works. So we really appreciate that thousands of Alameda residents have gone off island to get tested. It's very important. Some of your doctors can do it for you in their offices, but we would love to be able to bring testing locally to Alameda. And so, yes, we are working on that. Later this month, we should, and maybe even by next week, we should know some dates. But yeah, definitely coming up. And the other little tidbit I can throw out, because it's moving along well, is we're also going to have a flu vaccination clinic site. Now, I still want you, if you have the opportunity and the ability to go to your doctor or Kaiser or whatever, get your flu shot now. But soon, a little later, this fall, we are looking at doing flu vaccination clinic in Alameda. And this is really important. I like to keep you all informed, because not only for all the reasons we talked about, you need to get your flu shots, but it's also a trial run for when we get those COVID vaccinations, for how would you vaccinate a whole city. And so it's just, it pleases me that the county reached out and said, would Alameda like to work with us to set up one of these sites? And I only ever say yes. Well, no, that's not true. But when it comes to our public safety and health, your health and safety is my top concern. So keep doing what you're doing, because you make my job easier when you just do all the things we've asked you to do, and it allows us to open our businesses that have really been suffering and getting our school kids back to school. And I think, was there another question, Sarah?
Yeah, one last question, and I was just going to mention that Alameda Health System has their Alameda Hospital free flu shot clinic. It's Saturday, October 24th. It's 9 a.m. to 12 p.m. It is while supplies last, and it's in the parking lot at Alameda Hospital. So free flu shots, October 24th, 9 to noon.
Do you have time? 9 to noon. Okay, thanks. Yeah.
And then the last question was just asking about the county's health orders, asking why, and they actually preface this by saying maybe it's more for county health officials, but we'll ask you anyway, Mayor, why will indoor dining, churches, and theaters be allowed to open before schools are allowed to open?
Oh, they won't. Oh, they won't. That's the thing. You could see that if you went and you looked at the chart of the different tiers. indoor dining, theaters at reduced capacity, and churches. But I know the indoor dining and the theaters, we are definitely holding back in this county until the schools have had a chance to get their openings done. So the churches, I believe I heard, let's see if my iPad
I
is
think
able-
it's the most recent health order said that they were going to look at of reduced capacities for indoor dining, theaters and churches the week of the 24th. So the health order said the week of the 13th for schools, and then the week of the 24th for those other.
Right. And I also think, I'm trying to reach for my iPad so I can look at what, I was just on a call with County Public Health earlier this week, and Dr. Moss talked about how the thing about outdoor dining is that really is and theaters are really the riskiest kinds of venues. And I totally understand the concerns restaurants have as they go into the winter months, and we talked a little bit about heaters and spaces and stuff, but they want to get the schools up and running and see how that's going. And then, and I think even when you get a date, a possible opening date, it's that, will you submit all your plans, and we look them over, and we still have to look at our metrics. I know there's an iPad here somewhere, but I'm not putting my hands on it. But I do know that the priority, and Dr. Moss was very clear about it, is our children, our school children. So,
And that was the last question.
oh, okay. Okay. Yeah. Thank you again, all of you, for joining us. And please just help amplify the message of all the things we need to do to keep reducing our COVID numbers, especially, I mean, you wouldn't think it was fall looking outside today, but soon we will be having that cooler weather that drives people inside. And so just, talk to everyone you know about doing the right thing, set a good example. I know you are. Great to see you, and we'll be back next week. Thank you so much, Sarah. Good
Thank
to
you,
see you all.
everyone.
Take
Bye.
care. Stay safe. Wear your masks. Bye-bye.